Hi guys, happy St. Patrick's Day. It is Tuesday, March 17th, 2020. So, you saw my video yesterday. I went to the doctor. Let me start with this. This is what it looks like in every small doctor's office that you go in throughout the entire country right now. This is it. This is what you see. Okay? So, on top of seeing this, telling you these things, they've now added additional signs that say, if you have a cough, wear a mask. If you're sneezing, wear a mask. If you have a fever, wear a mask. Okay, well, I didn't have any masks at home. So I was expecting to have one given to me or available at the doctor's office. So I walk in and there's no masks. So I walk to the counter to check in. I stand back about 10, maybe even 15 feet. And I tell the lady, I'm here for my appointment, give her my name. She doesn't offer me a mask. So I finish talking to her, and I'm waiting for her to offer me a mask, just a trial and everything. So I go sit down. There's nobody in the waiting room. I'm the only person there. I don't know if that was intentionally done because they knew my symptoms or what was going on. Normally, that waiting room is packed. There was nobody in there. I was the only person. So I wait about a minute for her to tell me I need to put a mask on. She doesn't. So I walk up to the window and I go, you know that there's no masks out here. And I've had a cough and you can see right in my chart why I'm here and what I'm coming to my appointment for. So do you have a mask? So she hands me a mask. Here's my mask. So I put this bad boy on. Got myself all covered up, right? They immediately call me in. The nurse takes my weight, takes me to my room, sits me down. Before she does my temperature, which is usually the first thing they do, she takes my blood pressure. Well, my blood pressures are always low. So she's like, your blood pressure's really low. I'm like, yes, look at my chart. It's always low. So then she proceeds to say, oh, I forgot my thermometer. I have to leave and come back with it. I understand, people forget things and they're under a lot of stress and chaos, I'm sure, having to adjust everything and do things like that. I know that our pediatrics office is not allowing anybody to come in at all. You have to call from your car when you arrive for your appointment and wait for them to call you back to call you in. Or if you're just picking up a medicine or a prescription or something, they will bring it out to you. They don't want you in the building. Not for the doctor that I go to, which I thought was a little strange. So, clearly you can hear my chest congestion is getting worse. They put me on an inhaler. I can't breathe at all. My voice keeps going in and out. It's super fun. So let's continue with this. So I get my little mask. I'm in there with the nurse, and she's saying, oh, I forgot my thermometer. Let me go get it. So she comes back, gets it, no fever. I was like, well, I know that my fever finally stopped after day 3. But now I have all the rest of it. Runny nose, coughing, can't breathe, severe chest congestion, achy, tired, that kind of thing. So she ends up going, let me put this oxygen sensor on your finger and see where it's at. Well, my oxygen's good. So then, it's good for me. Normally it's supposed to be above 95 and mine's 93, 94, but it's whatever. So then she proceeds to leave. I wait about 2 minutes. The doctor comes in. I love my doctor. My doctor's great. I've always loved going to him. He's very upfront and honest and to the point, and He knows what he's doing. He's been doing it a very long time. So he comes in and he's like talking to me all about the crotchy. Can't say the word, crotchy. He's talking to me all about the crotchy. So he tells me all this information about the recommendations that are set forth and the recommendations that they have to follow. And then he goes, how long have you had the symptoms? And I said, well, it started about Friday night. So 4 days now. And he goes, okay, have you been in contact with anybody? And I said, not that I'm aware of. He goes, what about people in your family? I go, well, my fiance. He goes, there's no cases here in this county as of yet. And I said, well, my fiance works out of this county in Monroe County where there's up to over 15 cases now. And one person, apparently, from what he told me, got pulled out of his work because he had to immediately be tested. This guy that he works straight next to, like, has to mix ingredients with. My fiance has an amazing immune system besides lung issues from his asthma. But other than that, his immune system's amazing. He never gets sick. So could he have brought it home and spread it? That's what my doctor's thinking. That's what he's telling me. So he tells me, and this is quoted directly from my doctor, so listen very carefully. I'm telling you, small communities throughout the United States, you go to the doctor because you don't feel good. This is what you're going to be told. No joke. This is coming from the doctor. I will show you the information in just a moment, but let me get this out. This is important, so pay attention. He tells me there's nothing they can do. They're not going to test me for the flu because this does not look like the flu. They can't test me for the Karachi because I'm not on a ventilator or over 65 at high risk of passing away from the Karachi. That's what he told me. He goes, there's nothing I can do. He goes, it's more than likely that you have this and I can't do anything about it. He goes, and it's the most frustrating thing that I've had to deal with in my entire life. So I'm sitting here going, well, what am I supposed to do? I've been out in the public. My entire family has been exposed. What am I supposed to do with this information? And he goes, you're quarantined for 7 days. You can't leave your house and go into public places. Like, I can get in my car and I could drive someplace, but I can't get out of my car. So essentially, I'm quarantined to my house for 7 days. 7 days, not 14. 7 days. So I ask him, why 7 days? And he tells me, the tests will be available, and I'm calling you when they are so I can test you. And I go, and what if it comes back positive? He goes, well, at that point, you've already been out. You've already done your thing. You've already exposed other people to it. He goes, you have to remain in quarantine for the 14 days, regardless of whether you're not sick and don't show any symptoms, because by that point in time, you'll probably be over it. But you and your entire family have to be quarantined. So I'm asking him, what about my family now? My fiance has work. Should he still continue to go to work? Should my kids still see their friends? What should be going on? I'm asking a healthcare professional because I don't know. So I want him to tell me. This is the response that I get from him, a healthcare professional. He tells me, yeah, they can all do whatever they need to do. It's just you. You're the only one with the symptoms. So you mean to tell me, you're seriously sitting here telling me that they can do whatever they want, even though they're asymptomatic, even though I potentially have this and you think that I have this, and you can't test me for it, so you have no idea. But they can continue to do what they want to do because they're not showing any signs of it yet. Or they could potentially not show signs of it. Isn't that defeating the purpose of this entire thing? shutting down everything, closing bars and restaurants, making it so you can only have takeout, which that's a whole nother thing. So you'll order takeout food from a restaurant that's shut down and you can't go in and dine in anymore. And how do you know that the person that's preparing your food doesn't have this? And then they're preparing your food and delivering it to you. The whole thing doesn't make any sense to me. Why would you do that? You don't know that your restaurant workers don't have this just because they're not showing symptoms. My fiance hasn't shown any symptoms, but I'm sick. I'm sick with something, and he says it's not the flu. Not the flu. This is not the flu, he says. Testing you for the flu is pointless. Because that's not what it is. Maybe it's bronchitis. No, it's not bronchitis, he says. I'm on an inhaler now. If I can't get it, I have to send my children in to pick up my inhaler because I can't go into public places. For good reason. Because this shouldn't be spreading. But at the same time, I shouldn't even be sending my children in to get my inhaler that I need to breathe through however long this is going to last. Because they could potentially have it and be spreading it and not even know it. This is why our lives are changing forever. I know that they're saying that this could last until August. Let's sit back and look at the bigger picture. It is March 17th. If you get into a routine, into a certain way of life, into everything going the way that it's going, and things go very smoothly with that, that's going to be something that people are going to be used to. So you think that you're going to shut everything down for, let's say, 5-6 months while you combat this invisible enemy. You're going to shut it down. People are going to get used to the way that things are. And then it's going to be a shock to the system when you open everything back up. Can you do it slowly? Yes. Is it going to take time? Yes. So for now, for the time being, this is our life. This is how we have to live. This is what our lives are going to look like. So people better buckle up and get used to it. And be prepared. This is what's wrong with these rural communities, these small communities. They can't handle this. They don't know how to handle this. This isn't something that they're equipped to do. Large, huge hospitals have been given all of this stuff and all of this money and all of these resources to deal with this. And then all of us little teeny tiny communities throughout the rest of the country, which is where a lot of Americans live, are being screwed. We're being screwed. All of these shutdowns in these major cities, all these quarantine areas in these major cities, that's great. We're helping in the major cities. But what about the rest of us? The rest of us who are trying to be proactive, have symptoms, go to our doctor, try to figure out what's going on, and they tell us, you can't. At least until it's available. It's the most frustrating thing ever. I want answers. I want serious answers. So I can protect myself, I can protect my family, and I can protect my community. I'm not getting my answers. I'm not going to get my answers anytime soon. And this is why it's spreading. This is why there's mass panic and chaos, and people have no idea what's going on because of this exact scenario that I am living through right now. This is what's happening. So let's take a look at my summary. I don't care if you guys see all the rest of this stuff, but let's take a look at this. If I can figure out my camera. Oh, of course, it's not going to read it very well. You see it right there, though. Over here. Yeah. Cannot rule out that. Can't rule it out. Influenza swab and Tamiflu not useful. cannot rule out the Karachi. Voluntary quarantine until at least 7 days out. Not mandatory quarantine. Voluntary. I said, so what if I absolutely have to go out? I'm not going to, but let's throw this scenario out there. What if I have to go out? He's like, yeah, I wouldn't suggest it, but sometimes you gotta do what you gotta do. Are you kidding me? Guys, I don't know. I don't know what's going to happen. I don't know what's going to happen to us little people because everything that's in the mainstream media is all about the big cities where there's hundreds of thousands of people. What about all the rest of us? What's going to happen to us? I'll tell you what's going to happen to us. Those of us that are prepared and have been preparing, we're going to come out on the other side way better than everybody else. But what about the people who aren't? What's going to happen to them? Man, I don't know. I really don't know. This shouldn't be the way that the healthcare system is. Something should be done about it. And it's not the doctor's fault, and it's not the nurse's fault, and it's not anybody's fault. The system is faulted. The system's been faulted. And now we're seeing with this crisis exactly where the faults lie. But here's the problem. When all of this blows over and it's said and done, and we have this crisis under control, do you think that they're going to look back at the faults and fix them? It's not going to happen. At least not for tiny little communities like a majority of us live in. It's not going to happen. They're going to fix the faults and the problems in the major hospitals. But not for us. And if and when this happens again, and it will, it's going to be the same thing, but probably on a larger scale. So, I think it's important to update you guys. I think it's important to share with you what I'm experiencing going through this situation. What the system looks like, what the system is and isn't capable of doing, because all you're hearing is, yay, we're rolling out tests, millions of these tests. But you can't take one. I can't take one. My kids can't take one. My fiance can't take one. My whole community can't take one. Unless you're already in the hospital. Or you present to the hospital with severe difficulty breathing to the point where you need oxygen or a respirator and to be put into a hospital bed. Those are the criteria my doctor gave to me to be tested for this currently. You have to be high risk, super high risk, and over the age of 65, or already in the hospital, presenting with symptoms. That's where we're at. Why when this started in Wuhan, did they not start making crap available, distributing it, getting it ready? You think it's going to stay over there? You think it's not going to come here? Well, with all of the travel that goes on a daily basis in the world, you think that once the craziness started in China, that it wasn't going to come here? Naive, man. That's a naive way of thinking. What's the best thing that you can do? Prepare for the worst and hope for the best. Why is it that us Americans have that mindset, quite a lot of us, yet our government never thinks ahead? Never sits back and goes, oh wow, this is crazy. Look at all this stuff that's happening. maybe we should get prepared. You know, like we tell the American people to do, but they don't listen to us. So, heed their own advice. Ain't gonna happen, man. It just ain't gonna happen. Alright, I gotta go. I gotta try to get one of my kids to go to the store and get my inhaler so I can breathe, because clearly I cannot breathe. And I'm looking to do a live stream on Thursday. Hopefully I can breathe by then. That's gonna kind of discuss a wide array of all sorts of different things. I want to get some numbers together. I want to start this from the beginning and follow it up till now. I want to have that data. I want to be able to screen share it with you guys and kind of find trends as a community, is where this has been going and where we think it's going to go and what we need to do to make sure that we're prepared. And I also want to discuss in that live stream different ways that we can get prepared, and different cool things that we can do, different meals that we can make, all of that kind of stuff. I want to go over that on Thursday. I'll probably set the live stream for 8 o'clock, and then I might go an hour, hour and a half. There's going to be a lot of information to go over, so I'm going to be working on that the next couple of days, getting these numbers together and getting this stuff ready for this live stream. So join me for it. It's going to be awesome. We're going to talk. I'm going to have an extra computer set up over here so we can chat. I can read your comments. I can do my stuff on the computer. You can see what's going on, and it'll be a good time. So join me Thursday night, 8 p.m., and we'll get a chatting about this stuff. I hope the rest of your Tuesday goes good, and that's all I got for now, so catch you on the flip side.